What is miners' lung and Potter's rot from occupational dusts? Imagine working in a dusty environment every day, breathing in tiny particles that can silently harm your lungs over time. That's what miners and pottery workers face. These conditions are called miners' lung and Potter's rot, and they are linked to long-term exposure to specific dusts in workplaces. Both are types of lung diseases caused by dust particles settling in the lungs and causing damage. Miners' lung, also known as coal worker pneumoconiosis, happens to coal miners who breathe in coal dust for years. The dust contains tiny coal particles and crystalline silica, which is a hard mineral. When inhaled, these particles settle deep in the lungs, causing inflammation and scarring. Over time, the lungs become stiff and less able to work properly. Miners with miners' lung often have a persistent cough, feel short of breath, and produce sputum or phlegm. If the exposure continues, the disease can worsen into a severe form called progressive massive fibrosis, which can make breathing extremely difficult. Interestingly, even miners who do not smoke can develop COPD or chronic obstructive pulmonary disease because of dust exposure. The more dust a miner inhales over their career, especially in underground mines, the higher their risk of lung problems. Studies show that miners with high dust exposure are more likely to die from respiratory diseases than the general population. Potter's rot is a term used for a lung disease that affects workers in pottery and ceramics factories. These workers breathe in silica dust created when processing clay and other materials. Silica dust is made of tiny crystals that can get deep into the lungs. When inhaled, silica causes inflammation and fibrosis, which is scarring of the lung tissue. This scarring makes it harder for the lungs to expand and contract, leading to breathing problems. Potter's rot is a form of silicosis, a lung disease caused by silica. People with this condition often develop symptoms like a cough, shortness of breath, and chest tightness. The exposure to silica dust also raises the risk of other serious issues, such as tuberculosis and lung cancer. Both miners' lung and Potter's rot are linked to occupational dust exposure and can cause COPD, which is a condition where airflow is blocked or reduced. The dust particles irritate the airways and damage the lung tissue, leading to chronic airflow limitation. These diseases show that working in dusty environments can be just as harmful as smoking. Protecting workers from dust exposure is vital. Using masks, proper ventilation, and dust control measures can help prevent these diseases. Regular health checks and lung function tests are also important for early detection. In summary, miners' lung results from breathing in coal dust, causing lung scarring and COPD. Potter's rot comes from inhaling silica dust in pottery work, leading to lung fibrosis and breathing problems. Both conditions cause long-term respiratory symptoms like cough and shortness of breath. Occupational dust exposure is a major risk factor for COPD, independent of smoking. Preventing dust inhalation through workplace safety measures is essential to keep workers healthy and breathing easier.